Hello, everybody. Yeah, there we are.
Okay, great. Awesome. Welcome. Still a minute till, so we'll give folks a few moments to join.
Hey, Jessica, it's Becky Yates. I'm going to see you tomorrow night.
Oh, hey, Becky. Good. Thanks for joining. Yeah, I can't wait to spend tomorrow with Matthew's UMC.
Yeah, I just saw this on Facebook, and I'm like, oh my goodness, I got to register.
Oh, well, thanks for coming. I appreciate it. And that's great that you're here. And welcome everybody else. Thanks for starting your week with us.
And do we have a raised hand, Benton Thomason?
Here. You changed my view. Cool. All right.
Hello, Andrew Hudgens.
Hello.
How are you?
Good. How are you?
Oh, we're well. You can't hide from us. You know, we see you there.
It's good to see y'all.
Good to see you too.
Okay.
All right, Jessica, you ready for me to kick it off while we have a couple other folks joining us?
Yeah, that sounds great, Chris.
All right, thank you. Hello, everybody. Thank you so much for joining us today. My name is Chris Purnell. I'm the Program Director for Partners in Health and Wholeness with the North Carolina Council of Churches. Just a little about PHW, our program, before we get started with our main presentation. For those who don't know, Partners in Health and Wholeness has been a program at the Council for 11 years. We work directly with faith communities all across the state. We have a staff of 6 people and work on all issues that are health related, with a specific focus on healthier eating, active living, freedom from nicotine, and mental health. About 3 years ago, 2 to 3 years ago, we also were hearing from you all out there that you wanted more information and you wanted more support around healthy aging, and also to go deeper into mental health resources. We have a scarcity of mental health resources in many of our rural counties. So about 2 years ago, we were very fortunate to talk with the Duke Endowment and received funding in 2020 to really have a laser focus on healthy aging and mental health issues. And also 3 years ago, we were fortunate to receive funding to work on the overdose crisis in North Carolina. At the time, we had 4 of the top 25 cities for overdose deaths in the nation. And as you may have read, anybody who's following, healthcare now knows that since COVID, those numbers are going up and up, with the expectation that emergency room visits and overdose could rise as much as 24%. So those are some of our focuses. And we, like I said, we work individually with partners all across the state, with your health communities, really trying to just walk with you and figure out with you what your community needs, what your congregations or faith communities want to do, and how we can be of service. So if any of that is of interest to you after this presentation or sometime in between, please reach out to us. Our email addresses will be in the chat. Our website will be in the chat. And if we're not already working with you, we see some familiar names on here that know the program and us very well. But if we're not, we would very much like to, so please reach out. So with that, we're bringing two of our programs together today, our mental health and our harm reduction around the overdose crisis. We're really excited about this. And I want to introduce you to two of our staff members who lead these efforts, the Reverend Jessica Stokes, our Associate Director for the Mental Health Advocacy, and Elizabeth Brewington, who is leading our overdose response programs. So thank you for joining us, and I will turn it over to them.
Thanks, Chris. Good morning, good afternoon, everyone. Oh my goodness. So what we'll be going over today, we're going to start off with some definitions around mental health and substance use. We'll then go into the deeper why of why it's so important for faith communities to be talking about this. We'll then go over what is harm reduction and talk about how do we practice community inclusion. And then we'll wrap up with the importance of language and then framing this work as a ministry and hopefully give you guys some ideas and also inspire kind of different ways to talk about substance use and harm reduction in your faith communities. So with that, I'll hand it over to Jessica.
Cool. Thanks, Elizabeth, and thanks everybody for joining us today. So to start us off, we're going to offer some definitions because mental health concerns and substance use disorders sometimes co-occur. And I want to point out that we're intentionally using mental health concerns with the hopes of opening up this phrase so that people feel empowered to acknowledge mental health concerns in their own lives, family, and work. And so for mental health concern, we're using NAMI's definition, which is the National Alliance on Mental Illness. They define it as a concern, illness, or condition that affects a person's thinking, feeling, behavior, or mood.
Thanks, Jessica. And then for substance use disorder, the definition we'll be using today is substance use disorders occur when recurrent use of alcohol and/or other drugs causes significant impairment, including health problems, disability, and failure to meet major responsibilities at work, school, and home. According to the National Institute of Drug Abuse, approximately half the people who have a substance use disorder will also experience a mental health concern at some point in their life. And this has a lot of reasons. Like Jessica mentioned, mental health concerns and substance use can co-occur. Sometimes people experiencing a mental health concern can use substances to treat their mental health concern. Certain illicit drugs can cause people to experience symptoms of mental health concerns. And finally, adverse childhood experiences, which are traumatic events occurring before the age of 18, notably between birth and kindergarten. ACEs can include all types of abuse, neglect, and hardship endured by a child that impacts their social, emotional, and mental and physical growth. And people who experience multiple ACEs are at a highly likelihood of developing mental health concerns and substance use disorders later on in life. So continuing on, for today's presentation, we'll be using the definition of a drug as any substance that in small amounts produces significant changes in the brain, body, or both. And so in this picture, we have various images of drugs that include alcohol, coffee, marijuana, aspirin, things like that. We'll also be talking about substance use as a spectrum. Like Jessica said, we want to open up these terms, and mental health concerns can happen at any point in various degrees, and same with substance use. And we do this work through the lens of harm reduction, which states that substance use has a spectrum. We just covered a lot of definitions. If you have any questions, feel free to put them in the chat or unmute and we can take them now. All right, we'll have plenty of time for questions at the end as well. I'll pass it over to Jessica.
Thanks, Elizabeth. So in order to help better destigmatize mental health and harm reduction, it's crucial that we are reminded of the whys, the deeper whys. So by that, we mean radical welcome, community inclusion, and shared dignity. Knowing our whys will help further sustain our work because this is tough work. It's an opportunity as it is. It's a hopeful opportunity, but this will help us sustain when things are hard. And so by the phrase radical welcome, we are referring to the Hebrew word shalom, which is a helpful foundation for this work. Shalom means the wholeness, well-being, and flourishing for all that God has created. God shows us how to bring shalom to the world by being involved. God is an involved God, and God does not turn away from hurt, pain, lack of justice, depression, violence, being exiled, or anything. God is involved in our world by bringing healing, hope, peace, and wholeness, and invites us daily to join this work, sacred work. Radical Welcome is a faith community practicing shalom. Faith communities are in the unique position to offer this type of welcome, a welcome that reduces shame, considers all that a person has endured in their life, and why that makes a person who they are. It is a trauma-informed, anti-racist welcome that doesn't will power dynamics, but instead does life with each other, and by doing so promotes health and wholeness. With community inclusion, we're referring to what Dr. Mark Salzer says is the opportunity to live in the community and be valued for one's uniqueness and abilities like anyone else. So this means that people will not only be included where the church may feel that it can fit people, such as groups maybe as Alcoholics Anonymous or involvement with the food pantry, but rather it will invite all people to be fully included in the church by fully participating in the life of the community as an equal. And with shared dignity, we mean that as children of God, we already have inherent dignity that is given to us by the radical love and grace that has allowed us to exist up to this very second. We each have dignity that is woven into our deepest beings that cannot be disputed by socioeconomic status, levels of debt, misdemeanors, substance use, divorce, mental illness, hunger, education levels, or any other blockade that society tries to put on our self-worth and how others perceive us. So the definition of dignity is the right for a person to be valued and respected for their own sake and to be treated ethically. But shared dignity means that all of our dignity is interwoven, reliant on God and each other. Because if your dignity is harmed, then my dignity is harmed. And if my dignity is harmed, ultimately yours is too. And we are all impacted. This is tied to also Matthew 25, when Jesus said, whatever you do for the least of these, you did for me. And so with this, with our various ministries and relationships, this serves as a reminder that our contributions should not be seen as an offering or a giving of dignity, but rather a sharing of dignity. When we help each other, help others in our community, or when we receive help in our community, that is a shared moment which God is ultimately helping us all, providing as always. And so it isn't a transaction of power, but a reminder that we are all in this together, and you are loved because of who you are, not because of what you need or what you may be able to offer. And so when we do this life together, hear each other's stories, know each other's names, see each other, spend time with each other, that space is the kingdom of God. Framing our work on harm reduction and mental health around these theological convictions will improve these efforts greatly, and as mentioned, help sustain our work for when things are tough. Thanks, Elizabeth.
Thank you, Jessica. When Jessica and I started working on this presentation together, why we realized it would work so well is the philosophy of harm reduction is completely grounded in shared dignity and radical welcome and everything that Jessica so beautifully outlined. Now, you might have heard the phrase harm reduction in relation to drug use, and it is, as a philosophy, we're associated with reducing harm in our everyday lives. And so some examples of that are not associated to drug use would be wearing a helmet. We know that riding a bike, you have a high likelihood of crashing and possibly hurting your brain. So we reduce the harm associated with that by wearing a helmet. We know that car accidents are one of the leading causes of death in the US. So we have seat belts and airbags and speed limits, and we make sure we get our car inspected so we can be as safe as possible when doing a dangerous activity. And right now it is so hot, and the sun is a constant reminder that we need to wear sunscreen. Skin cancer is a huge risk in our lives, and so we do things to minimize that risk. So what is harm reduction? It's reducing harm associated with high risk of behavior to improve the quality of life. As mentioned earlier by those examples, it can include many programs, policies, and practices. And at its core, harm reduction celebrates the value of incremental gains. You'll often hear harm reductionists say any positive change. It's centered around dignity, compassion, and hope, and it looks different for every individual. And at its core, it's a philosophy. Now, when it comes to drug use, harm reduction is not anything goes. It is grounded in evidence-based practices. It's built on trust, and so we ask people to be honest and tell us what is going on in their lives. It is not enabling, and it's not a hook to get people into treatment. It's not a direct path for people to go to abstinence, but it's also not anti-abstinent. And it means that it meets people where they are and encourages them to make the best possible changes in their life for them. Back to you, Jessica.
Great, thanks. So how do we put all this together? How do we practice community inclusion and shared dignity? And with that, how do we reframe this entire approach and conversation with mental health and harm reduction as an opportunity instead of a challenge? Thanks, Elizabeth. Next slide. So the best way to start is to assess our current organization objectively. So our strategies, our approaches. By doing that, it helps us have an airplane view of our work, because the way we do things is how we model things. That's how we model how to do things for our communities. And so accessing this is a checking in on our culture, and that is the product of our ministry, the way things come to be. So evaluating our language, written and spoken. So the way we put things down into writing, from job contracts to social media. How do we come across when we have our language? That could also include sermons and Sunday school lessons and vacation Bible school. So how do we practice our language? Work environment. How are leaders practicing self-care and productive mental health practices? So think about if you are on staff at a faith community, or maybe you're on the personnel committee for your pastor. Think about that. And if folks are not practicing self-care, ask yourself with a lot of honesty, why is that? Maybe they don't feel that they can, and that should change. Who is already welcome, seen, who is not represented? So think about who may not see at worship. Is your board or personnel committee committed to mental health? If not, how might that change? So what is that? How's that come across? Is it written into the job contracts as mentioned? Are folks encouraged to take vacation time? Is sick leave, does that include being able to go to therapy, for instance, or to take care of whatever you may need? How is that encouraged is the biggest thing to check in on. Is your faith community, church, organization familiar with community concerns? Can you name prominent fears in your community or outside of your bubble of privilege? And this is crucial because community concerns are almost always mental health concerns. And it's crucial for us to think with language from, job contracts to sermons to the way we talk on social media and engage, is to think about using whole person first language. So what this means is that we want to avoid using professional and diagnosis and so forth as adjectives. So for instance, she is so schizophrenic, or he is an addict, or I'm feeling so bipolar today. Another word that even I catch my own self. We're retraining the tongue here, and unfortunately, a lot of muscle memory with our tongue, saying things like "that's so crazy" and different things, or insane. Which again, this is a day-to-day learning. We're all learning here. We all slip up, including myself. We want to move away from limiting a whole person's identity to what is a diagnosis used in medical communities. It hurts the person. It also limits how we view people too. When we can sum them up to an incorrect word that's certainly not how God sees that person, how we should not just limit that person as well. Oh, thanks. And our words, intentional or not, can become character statements. And I'm going to talk a little bit more about that later. Thanks, Elizabeth.
So some examples of words to avoid and words to use instead. Try to avoid using the word addict or junkie. Mm-hmm. Instead, say a person with substance use disorder or a person who uses drugs. I have a colleague who says she's never met an addict. She's met a Jamie, a Beth, a David, an Alex. So when in doubt, just use the person's name. Like Jessica mentioned, instead of using a diagnosis, say she has anorexia or he is living with obsessive compulsive disorder. Just those little changes in wording can really put the person back and not put a label on top of them. This slide will be included in a packet of resources that we'll send out to you at the end of this presentation. And I know from my own experience, it's been really helpful to try to reframe the word and language I use.
And with this, we also want to reframe the way that we talk about suicide. It's obviously a heavy topic, but faith communities, unfortunately, have a lot of experience around this, supporting families, supporting neighbors, maybe having this in your own life and family one way or the other. And so there's a lot of ways that we talk about suicide, unfortunately, that do promote stigma and shame. And so helpful language around suicide is to instead saying committed suicide, instead say died of or died by suicide. This is important because it can be painful for those with lived experience around suicide, or a person who has had a loved one die by suicide, when we unintentionally place moralistic judgment on someone with our words. So for instance, the phrase committed suicide evokes that person committed a crime. And in that context, it's a word that can promote shame and stigma. And because it's slandering a person who we have no idea what that person was going through, and we do not know that person's experience because we are not that person. And so for us to unintentionally put a judgment on anything that has happened is not helpful at all to that family or faith community or whoever loves that person. And so just a quick reminder on this. Another thing to say is move away from saying whether it's successful or unsuccessful. That phrasing is pretty dated now. We don't want to put any judgment on anything. So just say, instead of successful attempt, say suicide death by suicide, or unsuccessful attempt, instead say suicide attempt. So we don't want to say successful or not, because that, again, as you all can arrive there, is not helpful. And with that, I'm going to pause here for any questions. And again, I invite you all to either unmute yourself or offer questions in the chat for later. I know this is a lot of information to two sensitive topics. And the biggest thing with this, and I'm going off script here, but I think that intentions are what really are key here with working with people of all types of, experiences and stories, and we're all students here, which is refreshing to know that if you joined us today, you obviously have a heart for learning, and so we're grateful for that, because faith communities are really doing some cool things, and in this language and so forth only strengthens our ministries. All right, unless anyone has any questions, let's see here. We have a question. Oh, let me see.
Yeah, Jessica.
Mhm.
We will have a copy of the slides going out. Could you maybe just also mention the other resources that will be included in the email?
Sure. So what will happen is you have I'm really glad you are here, Joyce and Howard. There are folks from St. Paul's. We will send you a hard drive, a Google Drive with slides, mental health resources, harm reduction resources. It'll be all nice and organized, so you can access that anytime. And you'll get that link probably tomorrow, but soon. Is that right? The drive, anything
Yes.
forgetting in the drive?
Yes, it will be going out tomorrow along with a recording of this presentation. There'll be a copy of the slides that if you don't want the presentation, you just want the slides, that will be in there as well. And resources that Jessica has created around creating a trauma-informed ministry, a Sunday school guide around the overdose crisis, and prayers, and lots and lots of other resources.
Yeah, that's right. And the recording. That's great.
Thank you all, because I also am a note taker, and I don't want anybody to frantically have to take notes.
Yeah.
Thank you, Joyce and Howard.
Great. Well, I'll pass this back to you, Elizabeth.
All right. Now we're going to be transitioning and talking about mental health and harm reduction ministries and what those look like, and giving you some concrete examples of what that could possibly be. But to start this off, I'm going to use a quote that I love and have stolen from a colleague because I think it's beautiful. And it says, "What does love look like? It has the hands to help others. It has the feet to hasten to the poor and needy. It has the eyes to see misery and want. It has the ears to hear the sighs and sorrows of men. That is what love looks like," from St. Augustine. And like Jessica mentioned just a little bit ago, the intention behind all of this work is love and honoring an individual person's journey. And so when thinking about these ideas, as long as love is at the center of what you're doing, you're going to be doing a lot. And with that, I'm going to hand it over to Jessica.
Great. Thanks, Elizabeth. That's wonderful to center us. So with this, we're going to offer some practical ideas about how to do this work, but I wanted to share what is Temple University Collaborative on Community Inclusion of Individuals with Psychiatric Disability surveyed 101, or they surveyed faith communities all over our nation, and they received 101 responses. And I thought this was so fascinating and encouraging that, one, this many faith communities have been doing this work around mental health advocacy and including harm reduction, and that they shared what worked. And so please take away what you will from this. So common strategies that worked included educating the congregation. So that can begin by raising the issue during worship, to increasing the awareness of mental health and harm reduction issues in the congregation. For instance, during Mental Health Month in May, there's different Mental Health Awareness Week in October. September is Recovery Month. August 31st is Overdose Awareness Day, and holding forums and Wednesday night programming, hosting speakers and professionals on these topics, talking about ACEs, adverse childhood experiences, and talking about suicide prevention work, for instance. There's a million ways that a congregation can begin this work, and educating is crucial because it keeps everybody on the same page. Everybody has the same idea of why we're doing, why the ways we're doing, what we're doing and why we're doing it, what's the motivation to learn about productive language. And so it's not just, deacons and staff, but it's the entire church, and that helps pivot culture, faith community. Making a pledge, that's been extremely productive in many faith communities. So making a pledge as a community to learn and create authentic space for all. Examples of this include the WISE Covenant, United Church of Christ. The WISE Covenant stands for welcoming, inclusive, supportive, and engaged. And I love the WISE Covenant because any faith community can utilize their resources. So if you Google WISE Covenant, and you'll see all this in our follow-up email resources. They have awesome advice on how to start a mental health efforts and pledge, how to pledge together as community to learn, and also utilize partners health and wholeness resources, included becoming a trauma-informed faith community, the toolkit that we developed, and our Sunday school guide, our harm reduction Sunday school guide that was mentioned, utilizing these resources as a training and resource to the larger faith community can help. Also use a Partners in Health and Wholeness mini grant to host mental health first aid or another training called emotional CPR. That can be a great way to help get information out and promote this kind of learning. Also host a harm reduction clergy breakfast at your faith community. Elizabeth would love to work with you on that, and that's another great thing. And so the next thing is fully welcoming all. So we've already talked about this, but all with radical welcome, shared dignity, and community inclusion in mind, as we have laid out. There is success when all people are invited to fully participate in the life of the faith community. And this would become a great approach no matter what, but especially when it's talking about mental health and harm reduction. And then advocacy. Think about things in your local community. As we said earlier, local community concerns are almost always mental health concerns as well. So that includes things like access to resources, access to affordable health care, even clean drinking water certainly is a mental health concern if you don't have access to clean drinking water. So think about things from a local level, a state level, a federal level. And there's a lot of legislation surrounding mental health concerns and harm reduction work, and being familiar about what is going on from a advocacy level is a great way to advocate for people who may not be able to advocate for themselves. And so you can do this by keeping in contact with advocacy groups such as Mental Health America, the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, and the National Alliance on Mental Illness, also NAMI. And there's a lot of organizations to keep a pulse, keep a check on things. And then, of course, working with local mental health organizations, that is a great way to stay involved. And almost most counties in North Carolina have local NAMI affiliates. We're really fortunate in North Carolina to have what is the American Foundation for Suicide Prevention. We have a great chapter here in North Carolina, and Partners in Health and Wholeness, of course, would love to work with you. We have all this in our follow-up resources. Some quick ideas with all this, ideas for faith community, is to establish a health ministry that addresses mental health and substance use without stigma. So to wrap everything up with what we're talking about, this could be all kinds of ways to practice this work, including provide healthy cooking classes, host mental health programs that address mental illness, but also common experiences such as grief, loneliness, trauma, and more. Establish a mental health, emotional well-being book group. Host mental health first aid or Narcan or naloxone training and get congregants certified. Preach about mental health and harm reduction and normalize it from the pulpit. Host a community fair that highlights mental health resources And I will say, by doing that and inviting folks to table, mental health organizations to table, when you invite those folks to your faith community, they also learn, oh, this faith community is prioritizing this. They are helping get this information out. It speaks volumes about your faith community. And also, as mentioned before, host or attend a mental health first aid or emotional CPR training, which will have both of those resources in our follow-up. And with all this, we really want to consider areas of disfranchisement or inequity in our community. So with this, offering resources, learning about resources, we want to think about what are points of stress and what impacts our mental health in our day-to-day life in our neighborhood, and not just for us, but people who we do life with in our areas. And so around housing, wages, transportation, school districts, quality of grocery stores, access to healthcare, walkability, criminal justice systems, connect how all of these areas are impacted during community trauma, such as in a natural disaster or gun violence. And so what we're saying here is that as we're trying to help and think about things, we have to think about it sometimes more often than not from from an angle that is maybe not our own day-to-day life, but what may be a day-to-day life for someone else, particularly someone in need. And with that, we want to think about jobs and that day-to-day living. So think about a job ministry, develop a team of people that can help get folks connected with work and purpose. This can range from resume help, job training, job placement, to encouragement. Consider that some needing help with employment may have been previously incarcerated in addition to their mental illness or mental health concern, and support those that need help in completing their education. So there's a lot of different ways faith communities are set up to provide support if it's asked of faith community. And with a housing ministry, we can think about who we know in our large network. That's one of the strengths of a faith community, is that we have a huge network of people we know in our area. We can help identify housing that is safe, equitable, and meets the holistic needs of a person. So what we want to think about is, how can a faith community help support a person in need of housing, particularly those living with mental health concerns or in need of support around substance use. And so what we can think about is a deposit ministry. So if a faith community is willing to offer maybe a character statement, for instance, if a person has had a unfortunate rental history because of hardships and life, so forth, if a faith community and a property manager or whoever that may be is willing to accept a character statement, a faith community may be able to provide that and say, we know this person, we've known them for so long, we vouch for them, we support them. And with that, it would be amazing, and this has been happening, faith communities are stepping up to provide that deposit, that first month's rent, first month's deposit, and also think about helping someone set up utilities. Sometimes it's just $250, $300 a person needs to get their electric turned on, their water turned on. That can be life-changing for someone. And with that, finding rental agencies and property owners that will work with those. And so again, that character statement can be crucial, super crucial. Otherwise, somebody could be potentially looking for housing for a long time if otherwise.
Another example would be a medication take back. So this is an event where you can invite everybody in your congregation and everybody in the community to come turn in unused expired medication. It gets that unused expired medication out of your house. It makes sure that people can't get their hands on it. And it's a great way to involve the community. All that it takes is asking your local police department if they have a DEA trained agent. They come out and law enforcement is there to make sure that all the medication is properly disposed of. I had a colleague do one of these 2 years ago, and they got over 100 pounds of unused medication in one day. So this is a great way to make a huge impact in your local community. It also has the added environmental benefit of making sure that this unused medication isn't flushed down the toilet or any other way. Like Jessica mentioned, another way to get involved is in the naloxone training. Overdose Awareness Day is August 31st, so it's coming up in a few months. And so you could have an Overdose Awareness Day kit making party where people are all trained in how to use naloxone, which is the overdose reversal medication. You can ask attendees to put together naloxone kits for your local harm reduction organization or syringe exchange. I also encourage you to think outside the box, and these bags are an example of thinking outside the box. There is an organization in Catawba County called the Catawba Crafters, affectionately known as the Old Hookers, and they crocheted these bags. It is a washcloth pattern turned on its side and sewed up. And if you can see up at the top, that gray yarn is actually made out of a reflective material. So people who are unhoused or don't have electricity can find this life-saving medication, naloxone, by any light that they have. It's reflective. And this crafting group has been making these for their local harm reduction agency. The Presbyterian Church in Gastonia has also gotten involved. This is a great way to show love and care for people who use drugs that is not going out on the street and participating in a syringe exchange or doing a medication take back, but it's so personal and it's so filled with love. I can't think of a better word than love filled. I mean, you get a personal homemade bag that shows somebody's thinking of you and wants you to be safe. So thinking outside the box when it comes to your ministry. Other examples, you could have a supply drive. You could do a supply drive for wound care supplies, such as Band-Aids or antiseptic wipes or gauze. Local syringe exchanges always need those kinds of things. You could do a supply drive for syringe exchange kit supplies. You could do a transportation ministry. Transportation is a huge barrier for people who use drugs to getting to treatment, medication-assisted recovery, therapy. And so if you have a church van or a church bus and a bunch of volunteers, you can set up a transportation ministry and can really help people. Another way to get involved is to host a syringe exchange. Syringe exchanges have been legal in North Carolina since July of 2016. And these promote the building of trusting relationships between people who use drugs. And syringe exchanges are known to decrease the likelihood of HIV infections. There's no negative consequences associated with syringe exchanges. And people who participate in syringe exchange programs are 5 times more likely to enter abstinence-based treatment programs and to take a positive step. There are several syringe exchange programs that have partnered with local congregations to set up in their parking lot. There are some that have space at local churches. So there's tons of different ways that you can think about getting involved. Finally, what's very important for both people struggling with substance use and people struggling with mental health concerns are support groups. Your support groups that we all know, AA or NA, are wonderful resources, but I would also encourage you to think outside the box. Maybe a grief support group or a families who are directly impacted group. Maybe a people in active addiction group or an any positive change group. Or maybe a harm reduction works group. There are many different support groups out there for all the different people who are at different stages in their life. We've come to the end of our slideshow. If you have any questions, our contact info is right here. We are always welcome to please reach out to us and ask any questions you have, and we'd be happy to talk more about this. And thank you so much for your time and attention today. And we've got about 15 minutes to take question and answers, and would love to answer any while we have you.
Elizabeth, we do have a question in the chat.
Okay.
Have any of you heard of the community in, is it Giel, Belgium, that takes in persons living with mental and physical differences into their homes? The town has been doing this for 700 plus years and currently is struggling with keeping it going.
Oh, wow. I have not heard about this. I've heard about something similar in the Scandinavian countries where people who are struggling with Alzheimer's and dementia will live with people in their 20s as like a community. But no, that's very
Well, the
interesting.
town in Belgium has, some of the folks have stayed with the same family over generations. Like they started out as the daughter and then became like the sister and then the aunt. But I know because of kind of economics, it used to be an agricultural community. And so they called them boarders. They worked on the farms. They participated as any family member would.
It got started there. Apparently there was some type of healing ministry there.
Yeah, there's a Saint
Yeah.
Dimphna or
Yeah.
so, you know.
And people would come or bring loved ones there for healing. And then they would just end up being there in the community and they didn't have a place. So the families just started taking them in.
Yeah, it's kind of a unique situation
Mhm.
and a really wonderful approach, because when you're talking about language, they use very particular phrases to talk about people.
That's wonderful. Thanks for sharing that example. And I'm going to definitely research and learn more about that. That's great to know that another example of folks doing this work in the world and to gain insight and inspiration from.
Thank you.
Thank you all. And Ben, you have a hand raised. Do you have a question that you want or a comment? Or the hand might just be stuck on your screen. So if you do, yeah, anybody, please feel free to unmute yourself and just join in the conversation. We would love that.
In the meantime, I want to add that Elizabeth and I really look forward to the day that we get to do this in person for faith communities. So as your faith community, whatever that process looks like for opening back up or whatever that looks like meeting in person in the next year or whenever, please reach out to us if you would like us to come to your faith community and talk about harm reduction and mental health and different ways we can learn together and destigmatize and there's a lot of things we can talk about, but provide this presentation among others. Just know that we're happy to do that. This is my cat.
Jessica's going to be zooming in to our church tomorrow night. I'm a Stephen minister at our church, and I was asked, I'm in the process of starting a mental health ministry at the church. It's been approved, and the Stephen Ministry Group asked me to do the quarterly education because of my interest in mental health. And I stumbled across the videos, Sacred Conversations, that Jessica had been a part of on trauma-informed community. So that's how I discovered her. And tomorrow night, she's going to be helping Matthews get off to a good start for mental health.
Thanks, Becky. I really appreciate the shout out. And yes, thank you. I'm very happy to work with you all and do that together. And the invitation is open to anybody on this call for getting things going in your particular context, your particular faith community. Please reach out to anybody on the PHW team. But we are happy to help and work with you all.
Yeah, we have a comment. Mary, thank you, Elizabeth and Jessica. This is from High Country UCC. We absolutely love working with you all and really love coming to visit you. So anytime you want anybody to come to Boone, just please reach out.
Exactly. Love working with High Country UCC as well.
Love the work you're doing. Thank you so much.
Yeah, that's great. Thanks for joining, Mary. Well, and please know, if you think of something later on, please email us. This conversation is ongoing, so I understand. I'm the kind of person, I think about things after the fact. Hold on, what did they mean by this or that? So please just reach out to either of us. We're very happy to talk with you or set up a phone conversation or a Zoom call to talk about things specific to your faith community and how we can help.
Yeah, and Jessica, I just want to add, when we're able to do these in person, when we were doing them in person and in the future, we love people showing up on Zoom. It's been an incredible time to see people from all across the state. But when we are in person, we often do also have people from your community, either resource providers or partners. So that is something that if you're interested in seeing these folks in person, we often do bring our partners in who are right there where you can reach out to them.
I love that I just discovered a connection with Elizabeth. I know her parents.
Oh gosh, that's great. That's so funny.
Small
That is-
world.
What a wonderful small world.
Yeah, that's a huge connection.
This is Benton Thompson. Can you hear me?
Yes.
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 I'm retired from the health department in Caswell County, and I found the employee assistant programs to be very invaluable with working with staff and their family.
That's
I
good.
don't know with the COVID and all the changes, if y'all know if they're still in existence, but I found them to be a wonderful resource.
That's wonderful. Thanks for bringing that up. That is great. You know, the employee assistance program that you're talking about, I know that quite a few organizations have that. I was a chaplain once upon a time at a hospital. We had our own form of that. And so sometimes we have resources that we just forgot about. We may not remember them off the top of our head, especially if we're going through something or in need of support. So that's a great reminder of something we may have access to and that we simply have forgotten about. So thanks for bringing that up. Yeah, with that, I want to say one thing, and my friend Mary being on has reminded me of this, is that a big piece of this, another practical thing that faith communities can do in all this work is to normalize professional therapy. And so that can happen in many ways. A pastor, faith leader talking about if they have experience around therapy, talking about it, normalizing it, making it a thing that they have utilized for support personally and professionally. The more that we talk about professional therapy, better, because it also helps make our referral system stronger when we need to do a referral, a proper referral. And you know, therapy is obviously a set of skills that not all clergy have in our training, our professional training. And so with this, with mental health concerns and harm reduction and so forth, the more we talk about the beauty of self-growth, learning, processing it with professional support, I want to emphasize that professional support, better. Jill says something her faith community is, or our summer Sunday school forum is called Caring for Each Other, Mind, Body, and Spirit, and a sermon series that is going along with it. That's beautiful. That's great. I love that.
And Deborah, you had your hand up?
Yeah, quick question. When you mentioned the book club in one of the slides, have you actually run across any books that you had recommended for book clubs? And if so, is that included in the materials that you might be sending to us?
So I think did you mention, I mentioned book clubs for sure. And yes, I actually have, I think 6 or 7 books you'll see mental health resources in the Google Drive we're going to share with you. And at the bottom of that document, you'll see 6 or 7 books that I have put on there as starting places. But please reach out, because there are a lot of great books around mental health and emotional well-being and trauma and different things. So you'll see some on the resource guide. And
Okay, all right.
I also have several around the overdose crisis and kind of the history of the overdose crisis and the war on drugs.
Okay,
I'm
great.
leading a book study right now on a book called Grace for the Afflicted, a clinical and biblical perspective on mental illness by Matthew Stanford.
Okay.
So that's one option. And Amy Simpson also has a good book called Troubled Minds something. Can't remember the whole title, but that's another great book.
Okay, great. Thank you.
thanks, Becky.
I know of 2 books. One is called Christ on the Psych Ward by a young man, David Hosey, David Finn Hosey, Finnegan Hosey. And then Blessed Are the Crazy, which is written by a clergy woman. And I'm blanking on her name at the moment.
Blessed Are the Crazies.
Mm-hmm.
I haven't heard that. The first one I've heard of, and I'm blanking on the first author myself. Thanks for those suggestions. You sharing, bringing those. Great.
Sarah Lund Griffin might be the author of that second one. I can't remember.
Bill says yes.
But there's a lot of wonderful books, and I tell you what, I feel like every week, thankfully, so grateful for this. These conversations are becoming more mainstream, especially the past 5 years, I would say. And with COVID, the pandemic, we can no longer avoid these conversations. And so I am excited about what will come out the next year or two, already coming out in podcasts. And there's all kinds of mediums, ways to learn together and access this information. You know, that's one thing I need to add that to the slide, is that some folks just don't like to read, and that we're all busy and we're doing our best. And sometimes it's nice to talk about a podcast together, you know. So that's another idea of buying a book, and, you know, that's a point of access in itself, is, you know, getting a hold of a book. So think about podcasts too. And great idea.
There's a group in Colorado called Interfaith Mental Health Network, I think. Alan Johnson started it. I got on one of their calls the other night, and that's how I formally met Sarah Lund Griffin. I had watched something of hers. And then there's a group here in North Carolina called Minds Renewed. If you want to check out their website, it's Minds Renewed. And most of the people are from here in North Carolina, but there's a few other people that are a part of it, like Matthew Stanford. But it's both clergy and some providers. Warren Kinghorn from Duke is part of it. But I've been in correspondence with the guy who started it. I think he's from Winston-Salem, but a lot of really great resources, people in that group. Minds Renewed.
That's great. Awesome. Well, really appreciate you all joining us today. Any other thoughts, Elizabeth or Chris?
No, just thank you.
Yeah, thanks.
Thank you.
Looking forward to seeing you.
Yeah, y'all have a wonderful rest of your week.
Yeah, thanks for joining us, and so grateful for you all doing this work, learning about this work, and this is sacred work. So really, really grateful for you all.